Hello, my name is Ationi Aldarondo. I am the Executive Director of the Melissa Institute for Violence Prevention and Treatment. I welcome you to today's installment of our webcast series on understanding and preventing violence during the COVID-19 pandemic. The Melissa Institute is a nonprofit organization that for the past 24 years has been at the forefront in the use of science for the prevention and treatment of violence at home and in schools and communities. We take pride in educating and activating all sectors of society to prevent violence through research-based programs, trainings, academic forums, and webcasts with distinguished community leaders like Mr. Wayne Rawlins. It is really a great pleasure to have you with us, Wayne. And the last time that we saw each other was really the week of March 11th, only a few days before the COVID-19 pandemic came into our lives. And a lot had happened since then. Very important things, COVID and the murder of Mr. Floyd have really made inequality issues and racism unavoidable realities now in our country. And with that comes some opportunities for dialogue and progress that we hope we'll be able to capitalize. And I'm sure that you're doing your part to make that is the case. I'd like to open it up by asking you, first, how you're doing. I hope things are going well in your family. And then if you can take us through some of the things that you've been working with in the community and the impact as you see it, it's particularly in the African-American communities that you work with here in Miami.
Oh, thank you, Tioni. It is good to be back with you, at least virtually. And you're absolutely right. On March 11th, in Miami-Dade County, we hosted the Group Violence Intervention Call-In. Basically, we've identified the 1% or less than 1% of the individuals that are associated with 70% of the violence in the target areas of Brownsville and Liberty City. And so at that call-in, we basically delivered the message that, we want to see you alive, free, and safe. And, in delivering that message, we also offer supports for these individuals. If you want a job, you want to go back to school, you need help getting your driver's license reinstated, whatever it might be. And many of them took us up on that offer. And so they've been making that transition from being associated with those that are associated with violence to wanting to improve the quality of their lives. So immediately thereafter, the COVID-19 broke, right? And so now we were sheltered at home and everything. And we saw spikes in violence around the country because part of the Group Violence Intervention Network are sites that range from Sweden to Mexico to Los Angeles, Chicago, New York, all over the country and in certain parts of the world. So we, on regular dialogue, we have regular dialogues with those sites. And in Minneapolis is where also one of the GVI sites are. And after the George Floyd murder took place, then shootings in Minneapolis went up tenfold. They were seeing 23 shootings a day in Minneapolis. And it was like off the charts. So, and then as most of us saw in the news over the weekend, this weekend in New York, 64 shootings took place, 10 people murdered in New York. So fortunately for us, we've seen shootings and homicides go down. We have a very comprehensive strategy. We have street outreach workers. We have case managers. We have work that we're doing on the streets in terms of delivering PPE to the neighborhoods that are the hotspot neighborhoods for COVID-19, which also mirror the hotspot areas for violence. So there's a nexus between the hotspot areas for COVID-19 and the hotspot areas for violence. Yesterday we were in Allapattah and in Miami Gardens. The day before that, we were in Brownsville area. Today, this morning, we're back in Miami Gardens again, delivering PPE, masks, sanitizers, etc., to people that are in the hotspot area for COVID-19. And so it's interesting that, the nexus between improper healthcare and violence, it serves the same demographic. And so it all kind of bleeds into that whole disparity, between people of color and those that have other privileges. And so it's been an eye opener. We were out in Alapata, and one woman said, "My son is coming home. He's out of work. My husband's out of work. I don't work. I stay home to take care of the house and my family. And I'm so happy that you came to my door today to give me masks, because I have to make a choice. Do I buy food or do I buy mask?" If the choice is between food and masks, you're gonna buy food. So there are two different populations in Miami-Dade County and around America and around the world, I guess, for that matter. It's those that have and those that have not. That's really what it boils down to. So for some, shelter at home, no problem. And, we can do our work, we can Zoom all day and, still get paid. But there's others that they were already making menial wages, if at all, before the COVID broke. And so now you're stuck at home, no money. You're spending time with your family at a rate that you never spent so much time at home before. And you might find that, you don't really know who it is that you're living with. We saw a huge spike in domestic violence, after the shelter at home took place in our targeted area, of Brownsville and Liberty City. So, so it made it a situation that the home environment became more stressful. People were starting to find other ways to make money. We saw gambling go up. And when I'm not talking about gambling at Hard Rock Casino, dice games in public housing in the back alley, we saw that go up. We saw more robberies go up, so people were finding alternative ways to earn money. And in a COVID-19 environment. And one of the funny things, Etione, is we started distributing PPE and masks and gloves and all that, before we started this initiative with the surge teams with Miami-Dade County. And we found that we were sending our outreach workers to some of the most difficult places to go. I mean, where drugs were being sold, prostitution takes place, gambling, illegal gambling. Illegal gambling would take place in place, and then giving masks to them. So when they went out the first time, nobody had a mask on. When they go back out again to those same areas, you had drug dealers wearing masks, and everything. It's kind of crazy. But I mean, we want them safe too, because we find that the COVID-19 doesn't discriminate. It reaches anybody and everybody. And we found that a lot of the people that work in the prisons also were testing positive. So we worked with a group called Live Free out of Oakland, California. Pastor Mike McBride and here locally, Pastor Rhonda Thomas. We delivered 5,000 masks and sanitizers down to Homestead Correctional Institution, where we have our women housed, and I believe that they had a spike also in infections in Homestead. So we were able to support the women that are presently incarcerated with also PPE as well. So we forget about the, people that are incarcerated. We forget about the people that are down and out, in our troubled, in most challenged communities. So fortunately, we didn't forget about them, and we're out there. So anyway, the community has acknowledged our efforts, and we're not seeing the type of shootings and homicides that other places are seeing. In the last week, in our targeted area, we've had 2 shootings, in the last week. So now that's too many. And for some people that may be listening, that may be living in Parkland or Coral Gables or whatever, they may say, well, ooh, 2 a week, that's outrageous. Well, for Liberty City and Brownsville, that's pretty good. I mean, yes, it is too many, but it's still, a tremendous improvement from where we've come from, and compared to the rest of the country. Even South Miami-Dade has been challenged, with violence during the COVID-19. So we're very, very thankful that our strategy is working in the Brownsville and Liberty City. It's still relatively new. We're just a little over a year into the implementation of the Miami-Dade County Anti-Violence Initiative, but we're already seeing great results. And Itione, I think some of the, even more than the numbers, are some of the anecdotal things. Like, I mentioned earlier the call-in where we deliver the message of to those that are most likely to shoot or be shot, that we want you free, safe, and we deliver that message also in what we call custom notifications, where we go to our individual's doorstep and deliver that same message. Myself, a pastor, a representative from Commissioner Edmondson's office, we go and deliver that same message. And our very first custom notification client was a young man by the name of Gabriel Johnson. And Gabriel Johnson, we first met him at the Juvenile Detention Center. He was 17, about to turn 18. And when he was brought into the module, he got jumped while Circle of Brotherhood, our street outreach team, was delivering positive peer training inside the prison. I mean, inside the detention center. And so one of our people there notified me and said, I think we ought to do a custom notification with this young man. So we scheduled it, and we scheduled a custom notification with his manager. It turns out this kid is this young man is a rapper. And whenever he puts a rap out, he would get like 1,000 views. I'm sorry, 100,000 views on YouTube. And so he's very popular, but very controversial, because his raps were, quite frankly, hardcore violent. A lot of, semi-automatic weapons, foul language, the whole 9 yards. But it really kind of what his documentary was, living, in the inner city, public housings. This was his story, And so, but anyway, it was a very, very negative message. So anyway, we started to work with him. And one of our street outreach workers has a company called Black Man Music Group. And he started working with this young man, and they developed a video for Miami-Dade County Public Schools. Now, the same kid that had gun charges and was putting all this bad rap out is now putting a video together for Miami-Dade County Public Schools. So you may be saying, like, Wayne, what are you talking about? So at any rate, he put out a video about how to get a career in a year at Miami-Dade County Public Schools, vocational and technical colleges, how you can work to become a pharmacist, a pharmacist aide, and you can, become a mechanic, and you can, work on airplane mechanic, Baker Aviation, all these things, and in a rap, it still has the, the beat of the raps, and that it's popular with the young people. But Itione, they just released it July 4th. And it brought tears to my eyes to see the same kid that when we first met him, he was hardcore all the way. And then to see he's, using his talent to get other young people from, the urban core to go back to school and get a trade and earn a decent living for themselves, and then I literally, I cried, man. I'm not too ashamed to say that, a grown man cried watching this, to see that transformation of this young man. And, I'm not a listener to rap music, anymore. Those days are long gone. But when I listened to it, I was like, wow, this is incredible stuff, that this kid was putting out. So, I think we've made a connection, with the people that have associated with violence in the past, and we've shown them another way out. And we're sincere. And I instruct our staff, do not let 1 week go by and you don't make at least a 5-minute phone call to these guys. Let them know that we're still there. Let them know that we care. I don't care if they hang up on you. I don't care if they curse you out. I don't even care if they go to prison. If they go to prison, find a way to do a video visitation, which we have. We work with the jail system to do video visitation of the ones that have gone back to jail, and stay in contact, support their families. A lot of these guys have children, so when they get locked up, the wife or the girlfriend and the children are still there. They're in prison too, just by the virtue that their loved one is in prison. So we provide support, provide diapers and formula, whatever it takes. Maybe they got bullet holes in their window from a drive-by shooting. We go out there and repair the windows. So they know that we're for real, we're sincere, we're not going away. And then they also know that if they decide that they don't want to stop the violence, they don't want to stop the shooting, well, you're going to get our attention too in a different way, because we work with federal, state, and local law enforcement also. And so they know that it will be swift, certain, and just, but there will be a response, to violence. So we've been fortunate, Tioni, that, we're probably doing as good or better than any other place in the country that has had a history of gun violence right now. Everybody else is seeing spikes and we're seeing reductions. So we're very thankful for that. And and I just want to say, Melissa Institute is a part of that success, because you guys do the you guys help train us, in trauma-informed care and so forth. So, we're working with, experts in their field where we may not have all the expertise, but you bring expertise to the table to strengthen our capacity to be able to do this work. So, we appreciate Melissa's Institute for, being our partner also in helping to train our staff, our street outreach workers, and our case managers so we can deliver, higher quality services.
Well, Wayne, it's phenomenal for me to hear. Obviously, I keep tabs. I'm aware of some of the work that you and your group and your community partners are doing. But to hear it again, and to hear it expressed the way you do now is moving for me. It also, I have been reading and in preparation for today's talk, I've been looking at the data across the country too. And the story is a very different story. As you know, we have a surging sales on guns across the nation. So we have more people at home with more guns at home. We have more isolation taking place. The elements there for really another kind of like pandemic of violence to occur. So it is precisely that what motivated me to see how are we dealing with, what are we doing, because if we are not doing something intentional about this, it's gonna really come and hurt us all. We gotta, the eradication of COVID-19 needs to include violence prevention as a component of it. It's only separated in our minds, not in the reality of the people that we're trying to serve. And in this case, you do mention that there's increasing robberies and increasing gamblings, and the way, I like the way you put it. They were looking for ways. They're looking for ways to generate some revenues, so to speak. That is a way to generate that, and not to really justify it, but yet, even though they've done that, it's not really trickled into the violence part. And I wonder, what do you see as when you compare what you're doing here with your colleagues in other parts of the nation? What may be different from what you're doing and them, or cities like Detroit, cities like Chicago, cities like New York, as you mentioned?
Mm-hmm. Yeah, I think part of it is our collaboration, our partnerships. We have an amazing partnership with Miami-Dade Police Department. We have a partnership with Melissa Institute, and up and down the line, we've been very fortunate. We've been doing community justice work since the mid-90s. And so we have relationships with the U.S. Attorney's Office, the State Attorney's Office, the police departments, and in the community. People have known us. We've walked the streets. We walked in the public housing communities. We're there, and we've been there for the last 20 years. So people know us and they respect us and we respect them. And we're sincere about our efforts. We don't just, offer lip service that, yeah, we want to help you get a job, come down and see me. No, we come right to your doorstep, and bring the job right to you. With the surge teams, the Miami-Dade County surge teams that are going out, as I mentioned earlier, in the community, we specifically reached out to people that were unemployed, people that had criminal backgrounds, people that that are currently on probation, people that came out of the jails and nobody cared about them, but we cared about them. So, and that word travels, just like the kid I mentioned, and I say kid, but the young man that we assisted with the music video that he produced and all that for Miami-Dade County Public Schools. At first he was doubtful, about, who are these guys, and, are you snitches? Are you with the police or whatever? But we're still there, we keep coming back. We help, he's hungry, we help him get some food, whatever it takes to win their hearts over, we're there, even if we don't win their hearts over. Sometimes these guys, they hang up on us, they call us bad names, and we still call them back the next week. Hey, how's everything going?
Right.
And after a while, they're like, man, these guys just don't ever go away, and so, better, what do they say? If you can't beat them, join them. So we've really focused in on the ones that are most likely to shoot or be shot, the ones that are the most violent or are associated with the most violent groups, and focusing on them, because not everybody. You go to Liberty City, there's a lot of amazing people, amazing homes, hardworking folks. A lot of people are really strong in their faith and whatnot. Great people, but there's a 1% or half of 1% that is violent, and they're the ones that makes the news, and the ones that create the trauma and the havoc. So we focusing on them.
Okay. So the highest risk population. Yeah.
The very highest risk population, and working with them in the prisons, working with them on the streets, and just being consistent, and being there and not going away. I think that's really what has made the difference, and that philosophy bleeds through our whole strategy, from the mayor's office all the way to street outreach workers. We all have that same commitment. When we were at the call-in, we had the deputy mayor there, we had the chairwoman of the county commission, Audrey Edmondson. We had the chief, the director of the police department. So the major leadership in Miami-Dade County, from the top, were there addressing these young men and saying the same message. We want you to see free, alive, and safe. Period. All of us, from the top to the bottom. And then after that call-in, I'm quite sure a lot of them left there feeling that, this is a bunch of garbage, but we're still there. Even through the pandemic, we delivered food baskets to them. When people could not get to the drive-through. See, that's one of the things that we forget is, they've all these free food distribution giveaways, but it only is good if you have a car. If you can't drive to them, they don't accept walk-ups. So we take the food to their doorstep. We take the mask and the gloves and the hand sanitizer to their doorstep, and they appreciate it. Because a lot of these guys, they're just trying to make it, man. And they're caught up, they associate with, and see, the thing is that they grew up with these guys. Some of them went left, some went right, but they're still, the same kids that they played Optimus football with, same kids that they went to kindergarten with. I mean, you know, so that bonds and those relationships are still there. And so the peer influence, you know, it sometimes draws them in. And of course, the economics of the whole situation, you know, what are you going to do? If you've lost your job, it's the COVID pandemic, you know, you got bills to pay, family to feed. What are you going to do? You know, now that's not to condone any negative behavior or any illegal behavior at all. I don't condone it, because there's some people that are so resilient that they rise up above those challenges no matter what and don't do the wrong thing. But not everybody can do that. You know, so some people are victims of their own desires. They're victims of their own circumstance. But if you look at American descendants of slavery in America and the George Floyd murder, for 450 years, American descendants of slavery have had the foot on the neck, you know, and to see that play out live, well, not live, but, you know, on video with George Floyd, that's what made that murder so much different than all the others, because American descendants of slavery have had, and that's an expression that we've used in the past, they have their foot on my neck, you know? It's an expression that we've used. And it wasn't meant or intended to be what really happens. But when we saw it happen in Minneapolis to George Floyd, if you had any bit of heart at all, no matter if you were Black, white, Latinx, whatever, if you didn't have something in your heart, you must be dead. Because it was, you know, it's like, how can one human being do that to another human being? You know? And when I talked to one of the outreach workers in Minneapolis, who said that they're averaging 23 shootings a day now, which is 10 times more than what they were having. Their concern partially was that it's white supremacists doing some of the shooting. I was like, wow, how about that? Now, that's anecdotal, but we know, as you said at the beginning of this webinar, that there's a surge in gun purchases, right? Some people, when they heard that COVID-19 was coming, one group bought guns, the other group bought food.
Right. Right.
You know, yeah. You know, there are people that really want to hold on to that privilege, and they don't want to see Latinx. They don't want to see Black people. They went through 8 years of a Black president. They don't want to see it continue to head in that direction.
As I said at the beginning, the current situation of COVID and the murder of Floyd and the events that followed have made it unavoidable, the realization and the understanding that inequality and racism are integral parts of our life. This is no longer something that we can, or some parts of our society continue to pretend that is not there. So part of what sustained that inequality and that racism, not all of it, but part of what sustains that is precisely the marginalization and kind of like isolation in which we have kept, when I say we collectively have kept the African-American communities in our cities, in our country. I'm optimistic that will change, but I wanted to ask you if you thought, what other things, since we also speak to a different audience than the community that lives in Miami Gardens, in Liberty City, if there are things that you think they ought to be considering now as a way of supporting initiatives like yours.
Mm-hmm. Yeah, I think there's a couple of different things. Number one is continue to educate, you know, to continue for us to do the trainings, you know, for our teams. I think that there needs to be investment in the strategy, you know, and I think more in terms of just individuals, you know, individual investment, you know, adopting a person, and I'm not in the traditional sense of adoption, but, just take one individual, because we also often look at the stats, right? And stats are broad and they cover a segment of the population, but every single one of those stats is a person, that generates that stat. There's a person behind that, 95% of the people, blah, 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 blah. Each one of those percentages, there's a person behind that. So I think we need to start making those connections so that we understand that, it's not just what you see on 7 News or what you see, in the academic journal, but the real person behind that stat. And, how can I support that individual? They need diapers. This kid has got great talent. He wants to make other videos. Well, if you're into music, invest in his video, something positive, like he's doing for Miami-Dade Public School. I got to send you the link for that. You won't believe it.
Please do. We'll put it we'll link it to the webcast.
Yeah, man, you wouldn't believe it. I tell you, and to think, and if you want to do a little research, and I know you do, go listen, look at some of his videos before we got to him, and look at what he's doing now. So I mean, to take a kid like that and say, okay, we're going to invest in this young man. I'm going to follow him. I'm going to, when he starts to slip a little bit, I'm going to be on the phone to check up on him. Even if it's just, I'm going to make a 5-minute phone call once a week just to check up on this particular individual. We need those kind of connections. The women that are, housewives of the CEOs of these major corporations, they need to know what, Tawana in the hood is doing. Let's sit down and have tea together, so you can understand really what my experience is. And you know what? You will find that there's something in common. There's something in common between Tawana in the hood and Miss Heisinger. It's just, we all have something in common. And if we can make those individual connections, so it no longer becomes a stat that we're going to put in a proposal for funding, or, that image of that individual on the news, it becomes a real connection, and so we need to do that kind of thing. Now with the COVID-19, maybe a little bit more difficult, what did you call it back in the days, right? Pen pals, right? Even,
Right.
where you'd write to, that child in, somewhere in sub-Saharan Africa, that was, living in poverty, and, and you check and you write to them every week and like, how are you doing? Blah, 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 and you see that child, develop and grow. We need those kind of, mentoring, we need that kind of mentoring from the people that, support Melissa Institute, that associate with Melissa Institute. And we have the people. I mean, we can make the connection. We have like about 30 young men that we're investing the majority of our time. 30 is not a lot, but those 30 are making huge impacts. I mean, you said yourself, you're looking at the stats around the country,
Wow.
They're going through the roof,
Yeah.
But we're going down. I mean, last week I was like, we almost went the whole week without a shooting or homicide from the 27th to July 5th. We didn't have a shooting or homicide. And then July 5th, we had 2 the same day, broke my heart. But during that same time, Minneapolis had over 100. New York was about to have 64 in the week, on a weekend, 10 homicide. So we're doing something right.
I think it's these are times that required kind of like a concerted reflection, about where we've been, where we are, and where we're heading, and and we definitely know that we need to head there together. I look at programs like your efforts with the group violence intervention project and the work that you're doing in the community, and I see the seeds for, although that's only a small piece of the population, there is something about the humanity, the connectedness, the compassion, the care that you're showing for each other and for the mainly men, young men that you're working with, that I think perhaps, in my optimistic view of the world, carries kind of like the seeds for reconciliation and healing. So I want to thank you very much for watering those seeds, before the COVID and during the COVID, and also invite you as you identify needs and things that the community needs, that your program needs. If you think that at the Institute we can be of help, just let us know. We are, as I said to you off the camera earlier today, we are reinventing ourselves, our forms of expression and communicating with audiences in this new era. And everything is online now, we want to really bring all the voices of leaders like you that are really working for the common goal of making our community safer. So thank you very much for the bottom of my heart. And if following this session you have some ideas about what else we can do to assist you, just drop me a line. All right.
Thank you so much, Etienne.
Take care now.